everybody's going in that room, that's where it's happening.
The urgency is quiet. So are the most vulnerable.
1, 2, 3.
Proning unconscious patients so that their lungs can expand. It's a relentless routine to help those heaving for breath, while a healthcare system struggles to catch its own.
Guys, wait.
I have 2 empty beds, but it's going to be filled because I have 1 patient in emerge waiting to come up, 1 patient upstairs not doing well that needs to come down. So by today it will be full, most likely.
2 years in crisis mode. The cracks are now craters. Hospitals already under strain, carrying more with every wave. At Humber River Hospital, the people holding it up, like nurse Kamisha Marshall, are trying so hard not to crumble.
It is endless. It is endless. As soon as they come in, some die, then we get a replacement. Yeah, it's just endless. Yeah. A lot of nurses are sick with COVID themselves, so short of staff, working hard just to get these patients better. I need it to be over. I just want it to go away. Right. Just go away, yeah.
The pandemic hasn't gone away, but thousands of nurses have left the profession since it started. Chronic staff shortages have gone from bad to worse. Exhausted, many felt expendable too by low pay and wage caps. The load for those left, Ashley DeLumen says, keeps getting heavier.
We're always short. That's the hardest part, because instead of having 1 patient, we're getting 2 unstable patients.
How hard is that for you to manage?
You have to keep up with drips, make sure your patient is stable. You have to be on top of things for 2 unstable patients, so that's hard.
The turn to urgency can come with little warning. Omicron may be a milder variant, but it's still a cruel one. The sheer volume of cases means the proportion of critically ill patients is higher too. Most COVID patients in the ICU here are unvaccinated. Treating them can be an exercise in futility and frustration.
Is it frustrating in a way?
To be honest, yes, because this could have been, I can't say, right, but most likely this could have been prevented. But because, they have their freedom to choose what they want, then there's repercussions, which is just like this.
Yeah, we just
It's tiring, it's hard, it almost seems like this is our new norm. And, I want to be honest with you that, right now she's very fragile and frail.
The calls to loved ones are never easy. Neither is working on a constant brink, and every surge forces glaring questions on how best to survive this wave and any other.
If her breathing gets worse, it means her body is failing.
ICU doctor Sanjay Manosha says the perpetual present has lessons in it.
I think what's helped and what we've learned over the last 2 years is we have this critical care command center, which actually manages the system. And so the ability to move patients from one hospital to another, to allow them to continue their care and also allow the local hospital to manage with the influx of patients has been tremendous.
But Omicron has made every maneuver tighter because every hospital is under pressure, making access to all care even worse.
Now we're in a position where we cannot offer effective and timely treatment to other individuals like we used to for other issues. Surgeries have to be canceled. People are waiting for critical surgeries, investigations, intervention to carry on with their lives, and that's a huge toll. And what impact will that have down the road?
It's a looming question. So is the way out. Hospital admissions are lagging indicators. It means any reprieve comes later, and sometimes with resentment too. Vaccines have been so accessible for a year. Social worker Paula Abramczyk says those who don't get a shot keep putting everyone at risk.
They think it's just their right, their body. They can do what they want, but the effect is huge. It is sad that people can't have surgeries now because of the selfishness of others. It's overwhelming and it seems to be never ending. That's the frustrating part. There's no light at the end of the tunnel, especially in the ICU. Maybe other places in the hospital because those people actually get better, they go home, but these people are just not getting better. So we don't see a big light at the end of the tunnel here.
How are you doing?
Even outside of the ICU, any light can be hard to hold on to.
You ready to go home, eh?
Yeah, I'm ready to go home.
Emilio Perrone is going home. He's vaccinated. That helped him survive COVID. Julie Bork is happy he's leaving, but says it's harder to let go of the trauma of the last 2 years.
It's actually a huge relief.
to be able to send people home. Sorry. We've seen more death in 2 years than most people see in their careers. And it's hard to get past. It's hard to not let it get to you. Because you don't come into this profession to watch people die, you come to watch them get better and go home.
There is a real fear that the constant trauma will lead to even more burnout, that there will be more variants, more waves, more sick people, and fewer to care for them. Every potential COVID case is a stark reminder that reform is critical.
Your oxygen is looking much lower than I would like it to be.
Dr. Tasleem Nimji leads Humber's pandemic response and is the hospital's Chief Medical Innovation Officer.
We really need to strengthen the community resources and support integrations of care so that for a patient, you're not feeling like if I need something and I need something quickly, the only place I know to get it is to go to an emergency department.
Okay, take a big breath for me.
The better we get at preventative medicine, the better we get at predictive medicine, the less likely patients will need to come into an acute care center because they're in crisis. When I went in, so you turn it right down.
Investing in community and even remote care would lessen the chronic burden on hospitals, would make the next public health emergency, she says, less catastrophic.
To create the kind of change that we need, we're looking for really big sort of system disruptive ideas.
And you're optimistic that those will come?
I am. I mean, what's the alternative, right? There will always be patients that require a healthcare system that can support them. There will always be a burden of illness. There will always be people that are drawn to medicine because we want to treat patients. And so the more efficient we can make the system, the better we do at treating patients ultimately, and that's why we're here.
That commitment to care is still going through a devastating test. If change comes from this crisis, it can't come soon enough. Joanna Rumiliotis, CBC News, Toronto.